Hi, thanks for joining my session. I'm Kim Eckel, the founder and CEO of Footbridge for Families. Footbridge is a 501c3 based in Pittsburgh, Pennsylvania, and has helped over 1,000 families since our founding in 2020. Footbridge provides one-of-a-kind rapid support and service coordination for individuals and families facing financial crises which have no other solution. I'm here presenting today because home visitors have the opportunity to impact maternal and child health by developing a trusting and supportive relationship with caregivers. You as home visitors know this incredibly well. However, relationships such as these can be weakened or damaged when a family faces a financial crisis for which the home visitor cannot find a solution. In this session, I will talk about the innovative work that Footbridge for Families has been doing in the Pittsburgh area. Over 100 of the families whom we've served have been referred to us by home visitors in our community, and our results are incredibly exciting. There will be three components of my presentation: explaining the problem that we solve, sharing how we do our work, and sharing the results of what we do. I founded Footbridge in 2020 after winning a social innovation challenge, which gave me seed money to pilot our program. During that time, I had been working as a senior child welfare administrator and made aware of a problem that faces families across our country. Namely, the gaps in our country's safety net mean that relatively small, unexpected financial crises can lead to exponentially worse outcomes for families. To try and illustrate this, I'd like to try and provide an example. So let's talk about a mother that I'll call Sarah. Sarah had a job, but due to illness, had lost hours at work the month before and had fallen behind in rent. She was evicted. She had found a new apartment where she could afford monthly rent, but she had no way to come up with the additional $700 she would need as a first month's deposit. With no housing and nowhere else to turn, her only option was to sleep in her car with her two children. Because she was technically homeless, because she couldn't come up with $700, about the cost of a mattress, child welfare was forced to remove her children and place them with a foster family at what amounted to $56,000 for 6 months. $56,000. There are over 200 homes currently listed in the Pittsburgh area for less than. Healthcare professionals are trying to address the issues related to poverty that they see impacting the health of their patients, but like child welfare, struggle with existing referral options. The Camden Coalition, for example, has brought national attention to the fact that the gaps in our country's safety net dramatically impact physicians' ability to provide health care. Time-sensitive emergencies arise because of gaps in support in our social services system. These gaps result from income eligibility caps and available support, when families do not know about or apply incorrectly to existing programs, when the inflexibility of existing programs is unable to accommodate time-sensitive needs, or when there simply isn't a program to meet the crisis presented, such as a family's need for car insurance or support for medical co-payments. The social cost of these gaps in support can be tens to hundreds of thousands of dollars. When families face these crises that have no solution, it impacts the relationship of those who are trying to support families. As one home visitor told us, "It is very stressful when a client has needs I can't meet. I feel that it damages our relationship and that if I can't offer a resource, they don't trust me to help them with anything." Footbridge addresses the problem that I've just described by partnering with professionals like home visitors who bring us only true financial emergencies that can be resolved through no other means, but with our aid would lead to meaningful change. Our payments go to landlords, utility companies, car mechanics, always to the third-party vendor. Footbridge partners with every type of agency and professional who might identify a family facing a crisis, and in the Pittsburgh area have been working with home visitors since 2020. As I mentioned, over 100 of the 1,000 families whom we have helped have been referred to us by home visitors. Footbridge can cut red tape and meet families where they are by virtue of working with community stakeholders like home visitors. Unlike most other programs, families do not need internet, a printer, a scanner, paperwork, or even the ability to travel to our offices, we don't have any, in order to access our aid. They only need to answer a phone call. Families complete their applications for assistance within a few minutes over the phone, and our speed makes all the difference. 95% of those whom we've helped cite Footbridge as important or critically important in preventing a crisis from escalating, and 99% cite our aid as timely. Onboarded referral partners, such as home visitors, have the ability to quickly log on to our system by simply entering their email address and provide basic information about a family's situation. The process takes less than 5 minutes. Footbridge case coordinators are able to respond as quickly as indicated in the referral and always attempt outreach within 24 business hours. Turnaround time on payments can similarly be as expeditious as necessary, sometimes within hours. Efforts are taken to overnight certified checks when necessary. Again, all payments go directly to third-party vendors. In addition to expediting payments in order to stave off exponentially worse and more expensive situations, Footbridge case coordinators provide high-level support in ensuring families are enrolled in the means-tested programs for which they are eligible, providing warm handoffs to specific individuals at agencies, and sometimes conference calling in when a family needs help to support their application for longer-term aid. Finally, Footbridge interviews families to identify their larger goals and needs and has a partnership with the United Way in order to curate tailored referral recommendations. We send outcome letters with these recommendations to both caregivers we help as well as those who referred them to us so that they can offer long-term follow-through. Footbridge serves as an intermediary for organizations such as health and human service agencies, foundations, and healthcare plans seeking to address the short-term financial crises of individuals and families so as to prevent more expensive negative outcomes. Footbridge interviews families immediately following our aid and at 1, 3, and 6-month intervals in order to gauge the effectiveness of our support. Our evaluation findings are really exciting, and I'd like to take the time just to walk through some of them that are on this slide. Since our inception, Footbridge has helped over 1,000 families avoid the consequences of eviction, utility shutoffs, loss of a job if transportation couldn't be resolved, and other consequences that would fall from missing medical appointments. 100% of post-survey respondents reported that Footbridge prevented their financial crisis from escalating further. 92% reported being less stressed, 96% felt more hopeful. This one was really telling for me. 1/3 of our clients have stated that we helped mitigate a mental health crisis. And that makes sense given the work of actually talking with these families. When you don't know where your family's going to sleep the next day, that is, in fact, turning into a mental health crisis. 74% report that receiving financial assistance from Footbridge has enabled them to be their best selves when parenting. 92% reported feeling better supported by the referral partner, and 88% reported they were more likely to engage with and keep appointments with the referring organization in the future, which I think what we know about social determinants of health and maternal and child health, when you can really strengthen and build trust and supportive relationships, that's one of the most powerful things that you can do. Footbridge also more recently has been able to match the records of 2,435 individuals we have helped within Allegheny County's Department of Human Services DHS data warehouse. This Allegheny County is where Pittsburgh, PA is. This has allowed us to look at actual administrative data, health and human service administrative data for those whom we've helped. So this isn't just self-report findings. This is what the hard administrative data is telling us. Just 0.04% of our clients 6 months after our aid had to use an emergency shelter, with no one having to use a day shelter. Less than 1% had to have an inpatient hospitalization. Only 1.5% sought services for a mental health crisis. And excitingly for me, with my child welfare background, excluding families with child welfare involvement prior to our intervention, only 2% of our clients had to have a child welfare case opened in the 6 months following our aid, and only 0.5% had a placement. Going back to our self-report data, 79% self-report that Footbridge's financial aid is still making a difference in their family's financial situation 6 months later. Both survey and administrative data about our clients 6 months post-intervention Despite that being in a highly vulnerable situation, they were able to avoid utilization of our community's most expensive systems. The Footbridge model complements existing supports, filling in gaps as the payer of last resort, and offers our funders flexibility in crafting solutions. Our approach has been developed with a deep understanding of current ecosystems, including the natural dynamics within family units, the practical challenges faced by those undergoing financial difficulties, and the intricacies of political environments. Distinct from guaranteed basic income initiatives, Footbridge assistance avoids the potential pitfall of hitting benefit cliffs, making it an agreeable solution across the political spectrum. Health and human service leaders can no longer deny the importance of basic needs support to fill in gaps in our nation's safety net. Footbridge is certainly post-pilot, and we're poised for national growth, given the efficacy of our intervention. New business opportunities can be ramped up expeditiously with the time necessary to execute contracts, posing the activity that should be anticipated to take the longest. Footbridge's approach to data privacy and HIPAA is outlined on our website. And I would really love the chance to talk with you if whatever I shared struck a chord or if you're interested. My contact information is here, and I sincerely thank you for your time. Have a nice day.